Hi, I'm Dr. Jeff Forzley with Lemont Natural Healthcare. Today I'd like to talk about our autoimmune holistic recovery program. There are 3 doctors in our clinic, myself, Dr. Mark Long, and Dr. Matthew Imber. We are chiropractic physicians and holistic practitioners. Right now 100% of our practice is holistic medicine. Combined, we have 52 years of experience in the holistic field. I am board certified in integrative medicine. Dr. Long is a diplomate in the American Association of Integrative Medicine, and Dr. Imber is board eligible as a diplomate in functional neurology. Autoimmune conditions, our goals. Number 1, we need to get a proper diagnosis. Most of our patients come in with their diagnosis. We want to provide symptom relief, but just as important, we need to find and manage the underlying causes of your immune imbalance. We need to decrease inflammation in the body. We need to detoxify your body, your digestive system, your liver, and your kidneys. We need to improve the immune system. And how do we do all this? Number 1, proper testing. We're going to do some extensive comprehensive testing in order to find the underlying causes of your immune imbalance. We need to identify and eliminate food allergies. We need to heal the gut. The prerequisite for autoimmunity is leaky gut or intestinal permeability. This is a breakdown of the gut leading to an immune imbalance. Remember, 80% of your immune system is in your gut. It's a barrier and it keeps the toxins out of the blood. When the barrier breaks down, you have an immune reaction, as well as having enough of the good bacteria in the gut or your probiotics. We need to balance blood sugar. It's the number 1 stressor on the body. Insulin resistance, type 1 or 2 diabetes, hypoglycemia. These must be balanced because they put a stress on the immune system. Balance your body pH. Identify and eliminate toxins, especially heavy metals. So mercury, lead, and aluminum can really weaken your immune system. Other toxins can be antigens like viruses, parasites, bacteria, or yeast infections. And we need to balance your nervous system. Your nervous system controls every part of your body, including your immune system. Now, we want to compare medical versus holistic therapy. Medical treatment is steroids, and what steroids, corticosteroids, prednisone do is they can decrease inflammation, but they also can weaken your immune system. Also, medical treatment can consist of immunosuppressants like Enbrel, Remicade, or Humira, and these just shut down your immune system. The theory is when you shut down the immune system, it will not attack that part of the body that your immune system is attacking, and you will feel better, and you do feel a little bit better at first. However, in the long run, if you do not have a properly working immune system and it's suppressed, you're going to get sick more often and you can get cancer. Holistic therapy is finding the underlying cause or multiple causes, balancing it with natural therapy that works with your body and does not have side effects. We need to find the cause. If you do not find the underlying cause of your immune imbalances, you're not going to get better to the highest possible level. So finding the cause is our ultimate goal. Autoimmune conditions, your immune system, instead of protecting you from viruses and parasites and infections, it actually is attacking tissues of your body. Now, it can attack any tissue in your body, and the tissue that it attacks is what we pretty much put a name to it. If it attacks your joints and cartilage, it's rheumatoid arthritis. If it attacks the lining of your nerves, it's MS. If it attacks your organs, it's lupus. If it attacks your thyroid, it's Graves' or Hashimoto's disease. So there's many different autoimmune conditions. What happens is your body is making what we call autoantibodies, and these go out and destroy that particular tissue in your body. Your immune system, again, is supposed to protect you. Why would it attack you? 2 reasons: dysregulation and an active antigen. Dysregulation is chronic inflammation. That could be blood sugar imbalances like we talked about. That could be hormone imbalances, dietary allergies. So we need to look at blood sugar, the adrenal or stress glands, hormone imbalances, neurological imbalances, and a big part of this is poor digestion, leaky gut syndrome. Antigens can be any chronic infection, bacterial, parasites, yeast, viruses, anything like that. Food allergies, especially very common today, is gluten sensitivity and environmental toxins. We are just bombarded with toxins. We live in a toxic soup today. Everything, our food, cosmetics, in the air, in the water, we're surrounded. We put lotions and creams on and chemicals we use to clean our house and our dishes and our clothes. We are just surrounded with toxins, and they do absolutely no good for our immune systems. Autoimmune, if you are autoimmune against one tissue, let's say you just got diagnosed with rheumatoid arthritis. Your immune system is out of balance. It's attacking your cartilage in your joints. If you can take medication to decrease the inflammation and the pain, but if you do not address the underlying causes, your condition is never really going to go away. So we need to find and address the underlying imbalances. If you do not balance the cause of the imbalances, you can develop other autoimmune conditions. So you can get diagnosed with rheumatoid arthritis today, in a few years MS, in a few more years Hashimoto's thyroiditis, then all these different conditions. So not only helping you today with this condition, balancing your immune system can prevent you from getting other autoimmune conditions. They did a study in Milan, and they wanted to find out why people live to be 100 years of age. They looked at genetics, they looked at exercise. Did somebody have a happy life? Did they eat right? How was their sleep? Did they smoke cigarettes? Did they excessively drink alcohol? Out of all those factors involved, the number one factor was none of the people that they tested that were over at 100 had an autoimmune disease. This is really important. So not only making you feel better now, but extending your lifespan, we need to find and balance the underlying cause of your autoimmune condition. We compare autoimmune to a light dimmer switch. So you take that switch and you start to turn it and you hear a click. Once you hear the click, the lights are on, and as you continue to turn it up, the lights get brighter and brighter. Once you get diagnosed with an autoimmune condition, like clicking on the light, you can't be cured. We can't cure you. Medical doctors cannot cure you. You have to manage it as best you can. And managing it is like dimming down the lights. It's like lowering the attack on your tissues and thus the symptoms. Autoimmune diseases, there's many of them. Hashimoto's thyroiditis and Graves' disease involve the thyroid. Rheumatoid arthritis, there's abdominal, you've got the digestive system, Crohn's, ulcerative colitis, celiac disease. There's MS, ALS or Lou Gehrig's disease, Sjogren's, ankylosing spondylitis, type 1 diabetes, scleroderma, lupus, Raynaud's, eczema, myasthenia gravis, pernicious anemia, psoriasis. These are all autoimmune diseases, and again, it just depends on what tissue in your body your immune system is going to attack. The immune system, let's take a few minutes and explain this. The frontline defense of your immune system is called Th1 and Th2, and it works like a teeter-totter, and it basically balances itself. Th1 are your white blood cells, Th2 is your antibody response. This is like a chemical that will tag foreign invaders like viruses and parasites. It tags it, it tells the white blood cells to come over and kill this. So that's Th1 and 2. Th3 regulates Th1 and Th2. And Th3 is modulated by vitamin D, glutathione, which is the strongest antioxidant in the body, and essential fatty acids like fish oil. Th17 regulates Th1, 2, and 3. When Th1, 2, and 3 weaken and Th17 activates, now you have a tissue response where your immune system is attacking your own body. So when you get to Th17 activating, you have an autoimmune disease. There are things that we can do to balance all of these. Balancing blood sugar, your stress hormone, cortisol, and certain nutrients can balance Th17. Remember, it's about managing. There is no cure for autoimmune conditions. Leaky gut syndrome. Again, 80% of your immune system is in your gut. It must be addressed. We run a test for leaky gut. It's basically what we call intestinal permeability. It's a breakdown of the lining of the gut, and then you take, your gut is supposed to take your food and absorb the nutrients but keep the toxins out. When the breakdown occurs, the toxins also get into the bloodstream. Your immune system reacts to that, and weeks, months, and years of this weakens your immune system, and you end up with an autoimmune reaction. All this leaky gut, it all leads to autoimmunity. Again, we talked about 80% of your immune system is in your digestive system. When you get inflammation in the gut, whether it's because of leaky gut or not, you're going to produce what are called cytokines. These are inflammatory chemicals. They get into the blood, and number one, they can further degenerate leaky gut and perpetuate that. It can also get to the bloodstream. It gets in the blood, it goes to the brain, crosses the blood-brain barrier. It reacts with your brain's immune cells called microglia. Now you get inflammation in the brain. So inflammation in the gut means inflammation in the brain. The brain controls your immune system. It controls your digestive system. And that's what holistic therapy is all about. It's looking at all these systems of the body, how they interact together, and balancing all of that out. The nervous system, we just talked about that. The brain makes up 3% of your body weight, but it takes up to 20 to 30% of your metabolism. So oxygen, glucose, very important to keep that balance. Think about glucose being too high or too low. Hypoglycemia, too low, you can pass out. If it's too high, you can go into a diabetic coma. So we need to balance the brain because it controls so many functions in the body. And what we do in our clinic is very unique. We do something called neurometabolic therapy. So neurologically, the brain controls every function in your body, and we get that. We evaluate your brain, and we get it functioning at as high as possible level. Metabolically, we're going to directly look at your digestive system, your immune system. We're going to look at your hormones. We're going to look at diet, what you should or should not eat. What makes us unique? More extensive lab testing. We need to run different lab tests to find the underlying cause. If we don't find the underlying cause and manage it, you're just not going to get better at the highest possible level. We do neurometabolic therapy, as I just explained, and we use natural remedies that work with your body, and they don't have side effects when done properly. Autoimmune factors. We started just by talking about the immune system. Th1, 2, 3, and 17. We also are going to address your digestive system, your hormones and inflammation, the neurologic system, and nutrition. We need to run some tests to determine if you have food sensitivities or food allergies. If you take in a food that you're having an allergic reaction to, that is stressing your immune system. There's two basic types of food allergies. There's immunoglobulin E or IgE and immunoglobulin G, IgG. So we test these. IgE is a histamine reaction. You've heard of people that eat nuts, their throat swells up, and they're in the emergency room. That is a histamine reaction. You would know if you have this. IgG is not an immediate reaction, and it's not severe, but it runs your immune system down. If you eat eggs today and you have an IgG reaction or allergy, it can take 24 to 48 hours for you to feel symptoms, and those symptoms can be very vague, like I'm a little tired today, I have a little headache, my stomach's upset, but they're not symptoms that are going to put you in the hospital. It's very dangerous to have IgG food sensitivities because you never put your finger on it unless you get tested. We are going to test you. Now, if we feel we can help you and you decide you want to participate in our program to help your immune system, you must be willing to make some lifestyle changes, especially when it comes to diet. Your lab tests may be covered by your insurance, but holistic therapy that we do is not covered. Again, the labs may be covered. 99% of the government health sector budget is focused on treating illness, not prevention. Our healthcare system and health insurance companies are pharmaceutically driven. They don't make money through prevention. The United States makes up 5% of the world's population, but we consume over 50% of the prescription drugs, and we are ranked 37th in overall health. Something is wrong with this system. Billions of dollars are spent every year on medical research, including pharmaceutical drugs. But the incidence of so many chronic health diseases are on the rise. Obesity, heart attack, cancer, stroke, diabetes, autoimmune diseases, thyroid diseases, digestive, ulcerative colitis, Crohn's, irritable bowel, autism. All of these conditions, chronic health conditions, are on the rise, and holistic therapy works wonderfully with these. What I'd like you to do is take the next 10 seconds, and I want you to quickly, off the top of your head, think of 3 things that you can do right now to improve your health. So I'm going to give you 10 seconds. Okay, time is up. Now, most of the people that I ask this question to talk about eating better, getting more sleep, exercising, lowering stress, quitting smoking, things like that. What did you answer? None of the people that I asked say take more medications, and I would think none of you answered that way as well. If your autoimmune condition is having a major impact on your health and your current treatment is not working, I want you to know that there is hope. You can call us today for an appointment at 630-257-0550. I look forward to helping you, and I hope you enjoy this video.